think in the past, we've thought that our role in healthcare was diagnosing and treating patients. But what we have found is that in this research is that listening can actually improve clinical outcomes, improve patient experience, and actually has a wonderful impact on staff work-life balance. My name is Maureen Bizignano. I'm the President Emerita for the Institute for Healthcare Improvement. The message from this article is, I think, so critical for these times. We are talking in this article about research that shows the value and the values of listening. And I co-authored this article with Dr. Len Berry, a professor from Texas A&M Mays Business School, Dr. Nana Twamdanso, a senior vice president at the Institute for Healthcare Improvement, and Dr. Rana Oddish, the head of patient experience and hypertension at Henry Ford Health System. We came together to write this article because we were doing research on finding out the importance, new ways to communicate and to listen, and how critical that was. A lot of people had told me, I don't have time to listen. But what I really found out when I was interviewing them is they were saying, I don't know how to listen. And so we've got 6 very practical tips in this article on how to improve listening skills, how to practice those, and what kind of an impact they can have on patient care and patient outcomes. The first one is proximate listening skills. How can we really get close to someone and use micro affirmations, small gestures that let this person know that we are listening and that we care? The second is curiosity, and some really practical ways that we can demonstrate that we really do want to hear what the person, whether it's our teammate or a patient or a family member, are saying, what really matters to them. The third is enables trust. It's a word I'm hearing so much in healthcare today. We really need to actively build trust, and that's what these listening tools are doing. The fourth is the listening skills need to be aided by design. They need to be proximate. They need to help us. We need to design the process for listening so that we've got the time and the space and the energy, I think, to really have a conversation and to listen. When I've been visiting Mayo Clinic in the past, I've been really struck by the focus on proximate listening, on the design of rooms, on the design of the floors made of cork so that you don't hear footsteps coming down. It really, the whole design of the care system at Mayo struck me as incredibly important so that the conversations that we have with our patients' families and each other really and truly can make the difference in our care. We need to listen to empower, and not only to talk with someone, to really hear what matters to them, what truly should help be the design of the healthcare processes that they want and need. For patients, I would suggest that you think about what really matters to you. A lot of times I think patients are reluctant to raise some of the things that really do matter. It might be that they don't have support at home when they're discharged from a hospital, or it might be that they don't have enough money to fill a prescription. There are so many issues that patients are dealing with in their daily lives. And if we don't stop to really listen, we'll never hear those things. So for patients, I would suggest stop and think before you have an encounter with a clinical person, what really matters, not just clinical diagnosis, but tell us about your life. Tell us about the things that you find joy in. Tell us about what you're worried about. And perhaps make a little list. Make a little list about what matters to you. And when you sit down with someone, it's not just about sharing clinical information. It's about talking about the whole experience of care, life, and health. I think we need to help patients to see that we're not just focused on a lab result. We're focused on their health. And that means, do you have adequate resources and someone to get you food if you need it? What are those things that will help you to stay healthy in your home environment or the place where you live or work? And I think patients, if you get a little prep work done before you have that encounter, It'll give you the sense of how to raise those issues. For staff, I think the same thing is true. Stop before you walk into a room and get to know this person. It's not just a diagnosis. It's really, tell me what matters most to you today. And the last is that it will foster resilience. Some of the stories that we've heard are just so incredibly powerful when we take this approach to listening. So I would ask you to read this article and really take a minute to plan out what you might do with the very practical ideas in this article. I would love to hear from you, and I know our co-authors would as well. We're really collecting such powerful stories from around the world. One of the very brief stories in the article is from a nursing home in Norway that I was visiting, where a nurse was telling us about how challenging one of the patients was. He would yell and kick and scream, and nobody wanted to care for him. But when one of the nurses walked in to take care of him, to bathe him one morning, she said to him, "Tell me, what would make a good day for you today?" And he said, "I want to wear my blue shirt." And she said, "Why?" And he said, "That was my wife's favorite shirt, and she died 2 years ago today, and I want to honor her." And the whole time she bathed him, he told the nurse how they met, what their courtship was like, what their marriage was like, all the joy that they had had together. And at the end of the bath, he said to her, "Can you get me dressed? I want to go out and tell all the other patients about my wife." He had never interacted with them before, but that simple question brought out what mattered to him. That listening really made a difference. So I would encourage you to read the article and try all these practical tips today or tomorrow.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.